Hi, welcome to the patient's room. I've greeted myself. I am Angela, your nursing student. I've asked how they're doing. I did the patient identifier, name, date of birth. I told the patient why am I here. I'm here to place a Foley catheter. I've also asked, are there any pain? Do they have any latex allergies? I also checked for this bladder distension. I hand hygiene as I was walking in. Before I go to touch anything on the patient again, I like the hand hygiene again. I'm just that kind of person. So I'm explaining to the patient what I'm going to need her to do. So I explained to her that we're going to put it in a position that might be a little uncomfortable, but it's conducive for what I'm about to do, which is put in the Foley. They do not have any type of knee or hip surgery. So with some gloves, I'm going to hand hygiene again, put on some gloves, and go, and I'm going to prepare her for the Foley. I have a bath sheet for modesty. I'm going to put over her, and then I'm going to pull back the covers, and I'm going to position her in froggy leg, which is like this. So I position her into froggy. Okay. I'm going to take off my gloves, hand hygiene again, put on some more disposable non-sterile gloves. I'm going to get a chuck pad to put under her so I won't ruin her sheets. Now we're at that part. Oh, I'm also going to move the bed up. I'm kind of tall. So I'm going to adjust the bed for my height because I don't want to be bending over and hurting myself. All right, so the bed has been adjusted and now it's time to begin. This is where we're at with my kid. My kid looks terrible. I apologize. I'm going to have to fix it when this is over with. I'm talking too much. So anyway, moving on. Now we're ready to sterilely insert the catheter. I have a table near her. That's what I'm going to do the prep work before I move it between her legs. So that way sterility won't be broken because I'll be closer to her to put the Foley in. I've seen that and it just makes a lot of sense to me. So anywho, we're at that part. I'm going to take it out of the bag. I'm going to use my bag as a trash can. Like I said, the folding isn't that great, but sterilely, you're going to take everything down. There's gloves on top. These gloves are no more. I broke them trying to film the first one, so my apologies. You're going to take that out first, and we're going to set this aside on another table near, very, very close. You can get like a prep table, or you just something not here because you don't want to contaminate. So I'm going to put those over there without turning my back because that makes everything, it breaks sterility that way. I must have put this in wrong. Anyway, okay, really? You're going to grab, under normal circumstances, this is not on top. Forceps are not on top. But let's just say it did come that way. I'm going to grab probably, let's see. I'm going to grab about here, like so. And I'm going to do it carefully so that way, boom. All right, we're grabbing it on the ends. Shine it side down. We're going to put this under her buttocks. Okay? All right. Now it's time. I had gloves on. I had the disposable gloves on. We're going to take those gloves off because you don't want to touch her or anything like that. And you're going to now, this is a female. If it was a male, you would keep your gloves on and you would, of course, would you pull the skin back? I think I might as well wait till you're sterile. But anyway, moving on. Now, no. Now I'm going to take those gloves off, hand hygiene again, and I'm going to put my gloves on. Like I said, my gloves are not that great anymore. But, oh, geez, they're all broken up and popped. But for the purpose of this video, I'm going to have to wear them, unfortunately, until I can swipe some from work. Anyway, all right, so this is under the buttocks of my patient. We're gonna start taking things out. No, this is so wrong. I'm gonna have to do it without the gloves. I'm sorry, professors. We're gonna have to pretend I have gloves on. I don't have any more gloves, unfortunately. All right, so of course I have gloves on. I'm gonna grab this first. I'm going to do the KY jelly up in this little corner right here. All right, toss this. We're done. Into my little bag. Then I'm going to take the bed. I'm not going to open the bed down because it's stained and I have light stuff in my house and I don't want that everywhere. But I'm going to put it everywhere. Perfect. Throw that away. All right. So then Everything is still sterile. Don't get it too far in. We're going to take this tray, set this tray here, and you're going to take off the you're going to take the sheath off of this, and you're going to make sure everything's all set up. And before I start, I just want to make sure I'm all prepped up before I start the cleaning process. I won't be able to use both of my hands, because once one hand gets dirty, it's a wrap. I'm going to try to attach this like that. All right. I'm going to reach over and dip this into the KY jelly, and I'm going to have it to where it's off just a little bit. I'm going to lay this back in there. Put this back in there with the tip still sticking out with KY jelly on there. All right. Just remember, this is my patient over here with the drop cloth. I'm going to take this. This is my patient. And I'm going to stand on the right side because I am right-handed. With my sterile gloved hand, I am going to grab, we're going to do it this way. Let's say the patient is about here. So I'm trying to make sure my hand is in there. I do not want this to go to 10 minutes, but I guess it's going to. So anyway, my hands are going to be here, holding back, holding the patient in place. First, okay, we're going to put my trays down. It's safe to put them down. As I'm holding with my non-dominant hand, my dominant hand, I'm going to take the cotton swabs. I'm going to wipe down one side. I'm going to start with the left. Makes sense. Then we're going to do the right, front to back. Then we're going to go from the clitoris down, front to back. Okay? All right, now that we've done that, everything's going to get tossed out. This we are absolutely positively done with. I may want to put, a little more KY on there, but whatever. I might do that again just in case. Dippy dippy. As I'm holding the patient, I am going to start the process of, I'm going to grab this and kind of put it on the end there. Okay, we're going to find the meatus, and we're going to take our time, and we're going to tell the patient to bear down, and we're going to insert. Okay, we're going to insert until we get some urine. Once we get some urine, we're going to push it just a little bit more. This is a female. A male, you go all the way down to the hub. If you can, if you don't have any strictures or things of that nature. But yes, we're there. According to the manufacturer, it says 5 cc's of saline to blow the balloon up. Okay, that has happened. Of course, you don't want to leave it on there. Take that off. Throw that away. We're done. You're going to come back with your clean hand. And you're going to give it a nice little tug just to make sure that it is in place. All right. It is in place. It's in place. We're going to put everything down for now. This is not there anymore. Sorry about that, because we were done with that. All right, it's in my patient. I can now, because I'm at that point, I've already done the sterile part. Everything is checked. I've done the sterile part. Now I can toss these gloves off. Hand hygiene again. Put on some disposable gloves. I can go back in here because all this doesn't matter. We're going to take this out. Toss this box. Get it out of here. We're going to start very carefully because remember, it is in your patient. You don't want to be yanking like a crazy person, but you want to unkink it. Okay, you want to unkink it. You want to open up the bag if you can. And there's this little clippy that you can clip. And you want to make sure also you have the leg strap. And you're going to attach by the hub, if you can, with the leg strap. And then you're going to place this down on the side of the bed. There's a little hook that you can hook to the bed because you definitely don't want this to fall to the floor. Once you've done that, you can get yourself like a wet and a dry. Go back and clean off the rest of that betadine. You definitely don't want that on your patient. You've done that. Next thing you want to do, once again, take those gloves off. Hand hygiene. Put your gloves back on again. Now it's the process of placing her legs back comfortably. Asking her if she's in pain. She says no. Okay, great. You're going to pull that the disposable, this bad boy here, out from under her very carefully. This goes, that chuck pad goes and you are going to pull up her covers. Once you pull her covers up, you can take away the bath sheet because you fixed her legs. The legs are going from this to this. Everything's all set up. Once again, you ask her if she is okay, if she's doing well. She's like, yeah, of course. You're going to take your gloves off, hand hygiene again. Once again, I'm one of those people, I like to double check. You sure you're okay? Okay, great. You are done for the most part. You're going to chart anything, any abnormalities that you see, and take your trash, put it into the correct receptacle based on the facility's policy, and you are done. That should be it.